Hey there, Seth Myers with Son of Spine Sport and Rehab, and today we're going to show you a low back and even hip mobility drill using a lacrosse ball. So these are little firm round balls that I give to patients in the office for them to work through some of the soft tissue pain that we might be dealing with. So for this one, we're going to work on the back of the hip. So what Matt's going to do is take that lacrosse ball and he's going to put it just kind of down and outside of that bony dimply spot of that low back. So he's on that hip muscle. And then what he's going to do is lean into that ball on that spot against the wall, starting with his back kind of facing the wall like so. Usually what I'll have folks do here is angle the feet out slightly the direction we want to go, and then you're just going to slowly kind of pivot, working out to the side of that hip. As we rotate and pivot, if we get any good tender spots, we can stop and hold pressure there for about 20 or 30 seconds and then continue moving on. And then I like to try to add in some motion, especially with using this ball. So one way that we can do that for the back of the hip is to try to raise and lower that leg like so while that ball is on a good tender soft tissue spot. With this ball, I've got a couple rules that I tell folks. The first one is we don't want to be right on top of bone. That's why we put it right on that muscle. The number 2 rule is we don't want to get any of that numbness, tingling, leg falling asleep sensation. So if you get that, just move to a different area or come off of that ball. And the third one is we can overdo this ball. I usually have folks do this for about 2 to 5 minutes per area. It just depends on how big that area is so that we don't get super sore. But again, this is really great, this specific back of the hip drill with this ball for folks dealing with low back, leg pain, or even hip pain. So if you've got a ball or an object like that, a baseball or softball, give this one a try.